So let's start off with what exactly is heart failure. So in broad strokes, heart failure is a condition in when the heart loses the ability to pump enough blood to supply the organs of the body. And when we discuss heart failure, there's two broad categories that heart failure can happen. The first one is when the heart becomes progressively weaker and then becomes unable to pump blood to the rest of the body. You might hear this as heart failure of reduced ejection fraction or heart failure of systolic dysfunction, meaning the heart really can't mount the effort it needs to in order to pump blood. The second category is when the heart can become stiffened over time and it becomes unable to fill with blood, and that causes it to lose the ability to pump effectively. And you might hear this sometimes as heart failure with preserved ejection fraction or heart failure with diastolic dysfunction. Regardless of the mechanism of heart failure, in both scenarios, what can end up happening is that you can have a retention of fluid, also known as congestion, and that is where sometimes you might hear of congestive heart failure. The important thing to note is that heart failure is progressive. Over time, the heart function can get worse if you don't have appropriate treatment. So how common is heart failure? When you actually look at the numbers, it's actually quite staggering. So we are now calling it an epidemic in the United States. And when you look at how many people are diagnosed, you see that 6.5 million people over the age of 20 carry the diagnosis of heart failure in the United States. And we are estimating that there's over 900,000 cases of heart failure that are diagnosed every single year. It accounts for about 8.5% of all heart disease deaths in the United States and about 36% of all cardiovascular deaths. It really is quite impressive when you see how common heart failure is and how much of a impact it has on patients with cardiovascular disease. And you also see that it's probably one of the most common causes of hospitalizations in the United States. So who can get heart failure? So there are a few categories of people who are at an increased risk of developing heart failure. So the first column is people who already have some form of pre-existing cardiovascular or cardiac disease. Those with coronary disease, which Dr. Kukar already had outlined, in which there's fat deposits that create blockage in the heart arteries. Those who have suffered a heart attack or a myocardial infarction in the past. Those who have damage to the heart valves, and this is known as valvular heart disease. Those who have an enlarging and weakening of the heart muscle, which in a broad definition is known as a cardiomyopathy. Those who have heart defects at birth, known as congenital heart disease. And those who have a family history of heart failure, and that's known as a familial cardiomyopathy. And on the other column, we see that there are people who, even if they don't have pre-existing heart disease, still run the risk of heart failure. And these are patients who are obese, those who have sleep apnea or severe lung disease, because we know that it can create an increased amount of strain and pressure on the heart, those who have high blood pressure, and those who have diabetes. And what we know is that heart failure has profound effects in women. About 3 million American women carry the diagnosis of heart failure in the United States. And of the 900,000 new cases that are diagnosed every year, more than half of those are in women. And women die from congestive heart failure more often than men do, accounting for 56.3% of heart failure deaths. And to echo what Dr. Kukar said, it's pretty scary and it's quite impressive the impact that heart failure can have on women. Heart failure also presents differently in women, just like all other cardiovascular diseases. Women tend to develop heart failure at an older age than men, I apologize. Heart failure in women is more often caused by the stiffening of the heart as opposed to weakening of the heart. And the most common causes of heart failure in women are because of high blood pressure, coronary disease, and diabetes. There are causes of heart failure that are very specific to women, and one of those includes peripartum cardiomyopathy. It's a very rare case of heart failure in which the heart muscle weakens during the late stages or right after pregnancy. And so it's very specific to women and something that we definitely watch out for. And another important thing to note is that depression is frequently diagnosed in patients with heart failure, and it's more common in women than in men. So what are the symptoms of heart failure? So we like to use the acronym FACES, which stands for fatigue, activities limited, chest congestion, edema or swelling, particularly in the ankles, or shortness of breath. And we break down these into further subcategories. When we talk about fatigue, we mean, do you tire more easily? Do you just feel overall more fatigued and can't perform your general activities? Are you noticing swelling in your legs or ankles? When we talk about breathing difficulties or shortness of breath, are you getting short of breath from just doing simple activities such as walking the stairs, or not able to catch your breath after doing things you normally are able to do? Some telling symptoms are, do you wake up at night feeling like you can't breathe and you have to catch your breath? Or do you need more pillows to sleep comfortably at night? Because if you try to lie flat, you're having difficulty breathing and you feel that you need to prop yourself up. Or coughing. Are you having frequent episodes of coughing? And when you are coughing, are you bringing up pink or frothy type sputum? Or when you try to lie down in bed, do you find that all of a sudden you start coughing and you're bringing up the sputum? Keep in mind that coughing is very nonspecific and can be representative of other diseases. And so it's always important to talk to your doctor when you have this symptom, especially in conjunction with the other symptoms that we talked about. So what can you do to decrease your risk? And you'll find that some of these are very similar to what Dr. Kukar was talking about previously. Stopping smoking is the single most important thing you can do to decrease your cardiovascular risk as well as your heart failure risk. Increase your cardiovascular activity and also modify your diet. So what's the recommended amount of exercise? Generally, the recommendations is of 150 minutes of moderate intensity physical activity each week, or 75 minutes of vigorous intensity, or a combination of both. A general rule is that 2 minutes of moderate intensity accounts for the same as 1 minute of vigorous intensity. And for even more health benefits, try to do 300 minutes of moderate intensity or 150 of vigorous intensity each week. Basically, the bottom line is the more active you are, the more you'll find that you benefit from exercise. And just a couple examples of what's considered moderate intensity: brisk walking, aerobics, dancing, gardening, tennis, or slow biking. Examples of vigorous activity include hiking, running, swimming laps, aerobic dancing, heavy yard work, etc. Some key things to remember is when you're doing aerobic activity, do it for at least 10 minutes at a time and try to spread it out throughout the week. And when possible, try to incorporate muscle strength training at least 2 days a week. As always, talk to your doctor before starting any exercise regimen to see what's the safest and what's the best for you. Lastly, how do you modify your risk factors by your diet? Some key things are increase your intake of vegetables, such as greens, broccoli, cabbage, carrots, and fruits, especially those that have a lower glycemic index, such as apples, bananas, grapes, prunes. Try to increase your intake of whole grains, such as oatmeal, brown rice, or fat-free or low-fat dairy products, such as milk, cheese, or yogurt. And try to supplement your diet with protein-rich foods, which include fish, lean meats, poultry, eggs, legumes, and nuts. Basically, the more fresh your diet can be, the better you'll see the benefit. I know this is a lot to take in at one time, but here's some key things to take away from this. A lot of this you should be discussing with your doctor, and how to make the most of your visit is trying to ask some of these questions. For example, what are my risk factors for heart disease and stroke? What are the warning signs of heart disease and stroke? Do I need to lose or gain weight for my health? What's a healthy eating plan for me? What is my blood pressure and is it at a healthy level? What's my cholesterol and is it at a healthy level? Other things to ask is, what can I do to lower my risk of heart disease and stroke? And if you're around menopause, what should I know about the effects of menopause on my health? These are some key things that you can make the most of your doctor's visit and really can go very far in reducing your cardiovascular risk.